Teenage years are some of the most difficult, and that has been enhanced during the COVID pandemic. Mental health hospitals have seen an increase in the number of adolescents suffering from depression and considering suicide. New this morning in today's edition of Hello Idaho, Larry Gebert gives us some insight about the stigma of admitting you might need help.
Today on Hello Idaho, there's been a noticeable increase in the amount of adolescents, teenagers who are seeing depression or in depression and are considering suicide. Karina Druin is with us, and she is the Executive Director of Operations and Clinical Services at Cottonwood Creek Behavioral Hospital. Karina, are you seeing a noticeable increase in the amount of depression?
Yeah, I would say that we are. I'm not sure what exactly is causing that specifically, but I know that we're seeing a lot of increases in the depression and the anxiety, and I think that's largely attributed to the current state with the pandemic and all of the other things that are causing a lot of confusion for young people.
And I think that's understandable. Now, between you and your staff, and I know you communicate with your staff constantly, when these young people are coming to the hospital, some of them are against their will, some of them are checking in because of parents or whatever else, but I'm sure you're hearing from them, what brought them to this? What did they say brought them to the hospital finally?
Oftentimes just not knowing what else to do, not having any immediate answers. I would say that a lot of people don't get help soon enough at a lower level of care, seeking out counselors, seeking out medication therapy, or any of the other interventions that they might be able to do in the community. And so then they find themselves in crisis and not having anywhere else to turn.
And is that a case of just simply not knowing that those resources are there? Is that, I mean, the adolescents don't, and then there's parents or there's friends or whatever else that they might think, but everybody's so hesitant always to ever say anything.
I don't know if it's hesitant to say anything in like I don't want to deal with this kind of way, but I think most people think they can handle it. They think they can handle it, they think they can handle it. And then there's so much built up on top that then they just don't know what to do, because they keep trying to make do and trying to figure it out.
Makes perfect sense to me. It seems like the hardest thing to say would be, okay, I know I have a problem, without any professional identifying that, or to say, I know my kid, my child has a problem. I mean, nobody really wants to say that in their family.
I think that's one of the hardest things about stigma, and that asking for help means that you're weak, when it actually means that you're strong. And seeking help from support systems and professionals is actually showing you have strength and that you are willing to address things even though they're hard.
So just a reminder to anyone out there who's thinking about suicide or struggling with depression and maybe doesn't know it, take Karina's advice and be the person who does make that extra step. And you can also check it out online as well. Go to our website for Hello Idaho, and that way you can make sure that you're going to get that help.
And the Idaho Suicide Prevention Hotline is always available as well at 208-398-4357. And as Larry mentioned, we have a lot of information on our website. Just click on the Hello Idaho tab.